stop the rollout of the new healthcare law. But can hospitals survive if there isn't a health insurance mandate? And joining the company now is Andrew Rubin, Vice President at NYU Langone Medical Center. Andrew, welcome back to the program.
Good to be here.
Okay, you're saying if this mandate is struck down as unconstitutional, eventually, if that happens, then you and I and everybody else, we do not have to buy health insurance. You say that that is real bad news for hospitals. Spell out why.
Well, the individual mandate is the insurance system that's going to hold this whole healthcare reform together. And right now, hospitals are struggling because we have a lot of indigent care that we're taking care of for people in this country. Medicaid is the system for the poor, but there's still 30 million people who don't have health insurance, and many of them end up in the hospital emergency rooms, and we have to take care of them. So requiring everybody to have health insurance, whether you like or appreciate the constitutionality of that or not, essentially ensures that anyone who shows up in the hospital will have health insurance, and the hospitals
And you want that?
Well, we do want that.
You want this mandate to stay in place?
Well, we want this mandate to stay in place if we want this reform to stay in place. So this reform doesn't work without it, and the whole healthcare reform collapses under its own weight.
Okay, let's repeat that. You're saying if this mandate is put aside, declared unconstitutional, you can't have the mandate. At that point, Obamacare collapses.
Collapses.
It's gone.
It's gone. And we have a big problem because healthcare costs continue to go up. There's some cost provisions in Obamacare that reduces Medicare spending, which puts more pressure on hospitals. And then we're still going to have to be taking care of all these people who don't have health insurance.
Right.
And that means they show up, we can bill them, but they don't pay. So we're basically out of luck.
Now, as I understand it, hospitals are hiring a lot of general practitioners, putting those general practitioners, GP doctors, into clinics across the street from a hospital, run by the hospital,
right.
And the doctors are flocking to them. Is that the trend in GP medicine?
It is the trend. It's the trend for a lot of reasons. Number one, part of healthcare reform, and even without healthcare reform, there's a lot of focus on taking care of the patient a little better. So the way you do that and make sure that when they come into the hospital and they get discharged from the hospital, they don't end up back in the hospital, is you coordinate the care a little bit better.
Are you doing that at NYU Langone Center?
We are doing that a lot. We're building networks all around New York City to do it.
Does that, all around New York City you do?
Absolutely. As far as Long Island and Westchester.
Is there lower liability insurance for a doctor who's within the kind of practice that you're setting up?
No, not yet. We have to do
something.
Why not? Well, we have to do something about tort reform in this country. We all know it. I mean, it costs the healthcare system a lot of money, not just because of the malpractice verdicts, but because of medicine, the unnecessary testing that takes place.
Now, we went through this debate when healthcare reform was, going through the mill. And one of the principal points was, if you had tort reform, if you got the lawyers out of medicine, just to a small degree, you would really improve the system.
No
you
question.
Believe that?
No question. Absolutely no question about it. We spend too much money.
So where was the medical profession all through the healthcare debate, demanding tort reform? Where were you?
They were too quiet, and the Bar Association was too loud.
But the American Medical Association never made a murmur. Is there a hospital association of some sort?
There is, but
So where were you, Mr. Rubin?
The hospital associations were out trying to best protect the hospitals. The American Medical Association was trying to best protect the physicians. Listen, we all know this was a complicated legislation. There's no one piece that satisfies everybody. So I think the physicians wanted tort reform. They got a pilot program in the health bill, in the health law, but certainly it was nothing. It's a pilot program. Definitely not enough. Listen, there's so many things that need to be fixed in this law. We'll be talking about this for years.
And you'll be on the program if you're not careful.
I'll be back.
Andrew Rubin, thanks very much indeed.